Myers. My name is Sydney. I'm going to be your nurse today. I'm going to be doing a basic head-to-toe assessment. I'm just going to be checking cranial nerves, breath sounds, heart sounds, just checking arms, legs, pretty much an overall health assessment. It shouldn't take more than 10 minutes. I'm going to be using my stethoscope, this pen light, and mainly my hands. I'll explain everything I'm doing as I go through it, but if you have any questions, feel free to stop me. Does that sound okay to you?
Mm-hmm.
Okay, thank you. I'm going to pull back this curtain for privacy, using some hand hygiene. Okay, are you in a comfortable position?
Mm-hmm.
Okay, do you mind telling me your first, last name, and your date of birth?
Madison Myers, September 14, 1997.
Okay, let me just double check that, looks good. Okay, do you mind repeating your first and last name for me?
Madison Myers.
Do you know where you are?
My house.
And do you know what date it is?
September 2nd.
Okay, patient is orientated times 3 based on your verbal responses. Patient's speech is clear and patient's posture and hygiene seem adequate. I'm going to start with checking a few cranial nerves. Can you open your mouth for me? Okay, now don't let me close it. Okay, good. Now close your eyes and I'm going to touch one side of your cheek at a time. Tell me which side I'm touching.
Left. Right.
Okay, cranial nerve 5 is intact. You may open your eyes. Can you puff out your cheeks? Smile. Raise your eyebrows. Cranial nerve 7 is intact. Next, I'm going to be checking your eyes. Just look at my finger here. Okay. Good. Do that one more time. Perfect. Keep your eyes on here. Okay. Cranial nerve 3 is intact. Just from doing that, I can say pupils are equal, round, reactive to light, and accommodating. Next, I'm going to come behind you. Oh dear. And do a confrontation test. Just let me know when you see my hands on both sides.
See.
Okay, cranial nerve 2 is intact. Next, I'm going to be checking your extraocular eye movements. Keep your eyes on here. Okay, same thing this side. Okay, cranial nerves 3, 4, and 6 are intact. Next, I'm going to check your nose. Okay, no deviations, no abnormal discharge lesions. I'm going to check nasal patency. Breathe in. Okay, okay, good. Next, I'm going to check your ears. Rumen looks good, no lesions, no abnormal discharge. Okay. Then I'm going to just rub my fingers together. Tell me which ear you hear it in first.
Right. Left.
Okay, cranial nerve 8 is intact. Next, I'm going to be checking your mouth. Do you mind opening your mouth? Saying ah. Okay, uvula and tongue are midline. No lesions. Oral mucosa looks good. Do you mind swallowing for me? Cranial nerve 9 and 10 are intact. Do you mind sticking your tongue out? Moving it side to side. Cranial nerve 12 is intact. Next, I'm going to be checking your lymph nodes. I'm going to start here. Okay, submental, submandibular, preauricular, post-auricular auricle. I'm going to go back here. Occipital, posterior cervical, anterior cervical, tonsillar, and supraclavicular. Good. Do you mind shrugging your shoulders for me? Move your head side to side. Cranial nerve 11 is intact. Next, I'm going to check your thoracic cavity. Okay, anterior, posterior to transverse diameter is 1 to 2. Next, I'm going to be checking your spinal alignment. I'm sorry. Okay, do you mind just bending forward for me? Good. Okay, spine is in good alignment and just keep breathing normal. I'm checking for equal expansion. Thoracic excursion is symmetrical. Okay. Next, I'm going to be checking your respiratory rate. Just breathe normally. Respiratory rate is 12. Respiratory rhythm is normal. Respiratory depth is regular. No accessory muscles used and no cough is present. Okay. Next, I'm going to be checking your breath sounds. I'm going to listen 6 places on the front, 6 on the back, and 2 on the side. Just breathe normally like you would. Sit up a little bit, thank you. Okay. Okay. Okay, and I'm going to do the same thing on the back. Okay, breath sounds are clear. Next, I'm going to be checking your carotid pulses. I'm going to do one at a time. Okay. Okay, carotid pulses are strength +2 and equal. Next, I'm going to listen to your heart sounds. I'm going to be starting on the right side. Okay. Right sternal border, aortic valve, second intercostal space. Left sternal border, second intercostal space. Pulmonic valve, left sternal border, third intercostal space, Erb's point. Left sternal border, fourth intercostal space, tricuspid valve. Left midclavicular line, fifth intercostal space, mitral valve. All those sound good. Next, I'm going to be checking your abdomen. Do you mind laying down for me? Thank you. Okay, I'm just going to inspect it first. No scars, no distension. Stomach up here is flat in shape, smooth. I see a mole. That seems normal. Next, I'm going to be listening. I'm going to start in your right. Normals, findings. I meant to say findings are normal. Next, I'm going to listen. Start from your right side. Work my way around, just listening for bowel sounds. Okay, bowel sounds heard in all 4 quadrants. Next, I'm going to feel for any tenderness, distension, any masses. Let me know if you feel any pain. I start in the right lower quadrant. Any pain? Right upper quadrant. Left upper quadrant.
No.
And left lower quadrant.
No.
Okay, feels good. Next, I'm going to have you sit up for me. Okay, next I'm going to be checking some of your extremities. I'm just going to be feeling for edema, your temperature, any lesions, abnormalities, and any masses, any tenderness. Feels okay? Okay, can do the same over here. Any tenderness here? Nope. Okay, wonderful. Upper and lower extremities feel good. Next I'm going to be checking your pulses. Okay, radial pulses. Radial pulses, just make sure. Okay, radial pulses and brachial. Okay, pulse. Both pulses, strength +2 and equal. Posterior tibial pulse and dorsal pedis pulse. Strength in those 2 as well are +2 and equal. And then I am going to check for extremity strength. Okay, stick your arms out, push up. Side, side. Same with your legs. Push, pull, feet, push. Okay. Upper and lower extremity strengths. Upper and lower extremities are strong and equal. Forgot to ask earlier. When was your last bowel movement?
This morning.
Okay. And then everything was normal?
Yeah.
Okay. And then with urination, no pain, no change in color, odor, nothing like that? Okay. Things good. Okay, I'm going to check capillary refill. Okay. Capillary refill is less than 3 seconds and equal. And do the same for your toes. Capillary refill is less than 3 seconds and equal. Next, I'm going to be checking your range of motion. Can you bring your arms all the way up to your head, down, do some circles? Okay, same with your legs. Up, down, side, side, circles. Okay, upper and lower extremities have full range of motion. Okay, next I'm going to have you stand up for me, please. Okay, can you stand with your feet together? Arms at your side, eyes closed. Oh, I'm doing the Romberg test, just checking for balance. I'm standing right here in case you fall. Okay, eyes open. Romberg test is negative. Next, I'm going to be checking your gait. Just mind walking over there and back. Okay, gait is balanced, steady, posture is upright. Everything looks good. You can sit down now. Okay, is there anything else? You're good? You in a comfortable position? Okay. Again, my name is Sydney. I will be your nurse today. Just going to go document what I found. Is there anything else I can help you with? Get you? Okay. Thank you.